You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. With us, we have registered nurse Adrienne Bloom. Adrienne, welcome to the program.
Thank you, Randy. Glad to be here.
Now, we've had you on the program before.
Yes.
And for people that don't know, she works at the Cosmetic Surgery Institute of Palm Desert with plastic surgeon, I guess that everybody knows, Dr. Mo Zakhireh.
Dr. Mo.
And I've had you on the show at least 2 or 3 years ago.
About 2 years ago.
Back then it was just esthetician, taking care of skin.
Yes.
Now you're doing lasers and you're an RN.
I am an RN now.
So what is your role?
I do chemical peels, I act as an esthetician, and I also double as a registered nurse doing laser treatments.
Now, at the top of the show, we said you could look years younger without surgery. Do you believe that?
Absolutely.
With lasers and things like that?
With lasers, skin treatments, just refreshing the skin. You know, nowadays it's so great because there's so many different options that you can take with technology advancing and just what's out there. And sometimes it can be really overwhelming. I sometimes get overwhelmed myself sometimes, but it really can make a difference with the skin.
So who is the typical patient? When should somebody get a fractionated laser?
Well, that's a great question. I get asked that all the time. I get treatments myself. People always say, why would you have a treatment?
Because you have great skin. Yeah.
Thank you. I never used to. It's constant maintenance and taking care of it. But people always ask, you're so young, or your skin, you already have good skin. Why fix it? And Dr. Perricone.
That's right, he wrote the Perricone Principle. The dermatologist, right?
The dermatologist wrote the Perricone Principle, world-renowned for anti-aging. He stresses the importance of starting to stimulate the collagen early in your life. So 20s, 30s. 20s may sound a little young, but with time, I mean, you think about your skin now when you were younger. You know, you fall asleep and you have a wrinkle on the face, it goes away in a couple hours.
That's right.
Right? Well, when we age, not so much anymore. That wrinkle tends to stay there. So by getting laser treatments or stimulating that collagen earlier in life, you have a bigger surplus. And with time, the skin will just keep continuing to build and to grow.
So with fractionated lasers, so I understand this correctly, it's not like you're peeling off the skin and the wrinkles. You're actually heating the underlying skin and it fills in the wrinkles.
Exactly.
With collagen.
Exactly.
Is that right?
Well, we're creating little microscopic channels, and we're heating up that tissue, those deep dermal layers underneath the skin. We heat that up, and what happens is there's healthy tissue around these channels. By keeping healthy tissue around the channels, the skin heals faster. You stimulate collagen, you stimulate elastin, and slowly with time, over 2 and 3 months, the skin will start to repair and build itself, filling in acne scarring, filling in lines and wrinkles. And also with the erbium, we treat the surrounding skin around the wrinkle. So not only are we, from the dermal layers, lifting the wrinkles, we are also resurfacing the surroundings. So we're actually kind of debriding and resurfacing the skin around the wrinkle. So it matches. So you're getting the effects both superficially and dermally.
Okay, so you could make somebody, we said, years younger without surgery. You could take somebody 50 and make them look 40, in your opinion?
Why not?
I mean, have you seen that in the practice?
Absolutely. And you know what? Over a couple years, I have patients coming back in and they're reversing an age, and it's who doesn't want to reverse an age?
But we had a discussion in my green room over there, and it was very interesting what we were talking about, or what you were talking about, and that is that you could take somebody 35, and 10 years from now, they may look.
You know, we can't prove it, but in all honesty, I believe that in 10 years they will look virtually the same. They will have probably even better. You know, the pores will be tighter, the skin will be smoother, you'll have that youthful, radiant glow that still looks natural. And that's what we want to focus on. And that's so many women, men too, they just don't want to look unnatural. And they don't want their friends to notice. So with gradual treatments, and especially with Fraxel, you know, the skin improves over time. And
but the downtime could be a couple of days if you go light. 2-3 days?
If you go light, I just had it 5 weeks ago, and it was very light. And but if light is what you want, we can go light, and it takes 3 days. So it's 3 days. The next day it just looks like you've been in the Caribbean for a really long time. You're a little brown and red and tight, and then it starts to just kind of slough off. And what that helps with pores. So many clients want help with the pores, just a smoother complexion.
So you're heating the fractionated laser. You're heating the underlying tissues,
right?
And the body repairs by laying
itself.
down new collagen.
Exactly.
Filling in some of the wrinkles.
Exactly. Lifting those wrinkles.
Do you think people could avoid a facelift if they go in early? Your own personal opinion. You get somebody in the 28, 30 years old. I'm getting your opinion here.
Right.
And you do some of the Fraxels, and you do it consistently, and you do some of the treatment. Do you think that...
It's prevention, in one word. Prevention and maintenance. So I can't prove it, and maybe some people will need surgery. I'm not against.
Do you think your 35-year-olds and 40-year-olds in 10 years are going to look about where they look today if they follow your protocols?
Absolutely.
What about in 20 years?
No doubt. In
20 years?
20 years, I'd probably hold that to it too.
It's about the same.
Honestly, it makes such a big difference, and I'm very passionate about it, and just seeing the results firsthand and off clients, and it really makes a big difference, and we're all so excited.
So let's talk about red spots and brown spots.
Right, which is a major concern.
What can you do for those?
Well, pulse light is the most popular. You need a couple treatments. But it really targets pigment. Unfortunately, red is harder to eliminate than browns, but there is hope.
But browns, isn't that what most people in your 40s worry about? Browns
absolutely, and especially living in the desert. Golfers, active lifestyles, playing tennis, that is the #1 complaint when they come into the office.
What about olive skin? Can you, because I understand that there's a next generation of lasers that can do it. Can yours do it?
Absolutely. Olive skin. So if you have that darker olivey complexion, you can come in and it will be safe and effective for your skin type.
Laser technology.
Right.
And you think that's a future then? Of looking
my
younger?
gosh.
Is that part of every...
It's cutting edge. It's cutting edge. And it keeps changing. It keeps evolving. It keeps getting better. Before we had Retin-A and antibiotics or stripe, but now in addition to that, Retin-A is fantastic. I have a lot of clients on Retin-A. Okay. But there are other options. There are other options out there. And lasers are exciting.
They're exciting. Okay. And so if a patient's watching this, okay, so what is the questions you have for these people? How much downtime can you tolerate?
Right.
So like 5 days, 10 days?
Again, lifestyle. If you can tolerate the downtime, we can go a little deeper. We can really be aggressive with the skin. If you don't want the downtime, we can do another type of laser. We can do the IPL or the BBL. There's so many different options. So depending on your lifestyle and what you want to do, just come into the office. We'll assess the skin. We'll put you on a treatment program, and we'll go from there.
You see transformations all the time.
Absolutely. And that's what warms the heart. That's what makes getting up in the morning and going to work that much better, is the confidence that exudes these patients once they leave. Coming in and saying, "Oh my gosh, I've never thought that I would have a good complexion. I never thought anybody would ever say that to me." But there are options that you can have. There's hope, and you can get that self-esteem back. And
because people are dating. So are people, by the way, people that are watching this, 60s, 70s, 80s, that's young in the desert.
It is. It is young.
What do you say to those people that are maybe resistant to getting it done, getting anything done?
There's different levels. A lot of clients come in scared, not knowing.
What's their fear? What is their fear?
Well, we see on TV these Botox gone bad, or these chemical peels where you look really burned, and it's really not the reality of it when it's done correctly, and you really the results are speak for themselves, and you see.
So you don't want to look like you've had anything done. You just want to look fantastic for your age.
Right.
Is that the goal?
Exactly. Natural beauty.
Because great skin, we talked off camera. I mean, look, women want to know what guys talk about. Okay, right? But behind their back, great skin is sexy at any age. When you see somebody with great skin, that's a standout.
Absolutely.
That's a big thing.
That radiant glow from across the room, it really does a number. And you don't have to live in the skin that you're in anymore. and you can really improve at any age. You know, I was talking about starting younger, but even if you start later in life too, it's okay. We can still achieve results.
Okay. Do you have a competitive nature where you say, I want to turn this around for these people?
I do, because of my past, and I know that it works. So I just don't want anybody to get frustrated and to give up. Because
are there people like that?
Absolutely.
They just think I'm too far gone.
Yeah, I'm too far gone. Oh, honey, you can't fix this face. Oh, this old thing, and it's not the case. I'm not saying that we're gonna take, you know, and make you look like you're.
But it's affordable now.
And it's affordable. It's affordable. There's a lot of competition out there, so you kind of have to be affordable.
Thank you for coming on the show. Very good.
Thank you, Randy. Likewise.
You're watching The Wellness Hour. I'm Randy Alvarez. Up next, what you need to know about fillers. Are they a good idea? We'll be right back.